Hello, welcome to the Connecticut Tutorials. This is a project to help physicians and physicians in training learn additional bedside diagnostic skills. In charge of the project is Dr. Jody Tvorsky, a resident physician in internal medicine at the University of Connecticut Health Center. I am Henry Schneiderman, a faculty member, professor of medicine in the Division of Geriatrics and associate professor of pathology and vice president for medical services, Hebrew Home and Hospital in West Hartford, Connecticut. I'd like to introduce the series by showing you what a practicing physician carries in the pockets in a day when the black bag is no longer a common means of transporting. So I've laid out before me on the table here items that I keep on my person. And the analogy can either be the warrior wants to go into battle fully armed, or if that's offensive, that the workman going to a job wants to have the tools at hand to not have to walk backward again and again. A stethoscope is certainly familiar, and everyone will expect that you're carrying one. We'll talk more about stethoscopes later. If you don't carry a pen light with you, you will want it within the first 4 seconds of seeing any patient. I like to carry a bandage scissors with me for physical examination because getting the bandage off is an essential element in adequate exposure, a theme that will come about again and again as we talk to the individual practitioners who constitute this tutorial series. Paper. You need to be able to write down findings or you will forget some of them by the end of the day. A pen. Completely mundane and pedestrian, but if you don't have it, you will miss it. A reflex hammer. Unlike an ophthalmoscope, this is needed so often and so immediately that one does well to have it. And as you see, it can be fitted in the breast pocket or the white coat pockets. Gloves. Often in this age of universal precautions, and always if we're doing a genital or rectal examination, we need gloves. In my facility, all the units have small and medium gloves because almost all of the employees have small hands. I have a size 8 glove. By carrying disposable gloves in my pocket, I don't backtrack to go looking for them. Tongue blades. Nothing is more foolish than the sight of a physician looking in a patient's mouth, trying to get the tongue out of the way for lack of the simple expediency of carrying tongue blades. Notice they need not be sterile. If you have to pull on the tongue, you want to wear gloves and use a gauze. Any physician who has tried to move the slippery human tongue without a gauze can testify to the futility. And finally, a hemostat. Now, certainly we are healers and do many things that are therapeutic, and our examination is not merely diagnostic, it's also therapeutic. There's an infinity of uses for a hemostat. other than stanching the flow of blood, and I urge you to carry one with you. You will see in the segments that follow a variety of capable physicians with different foci talking about either the whole patient or a system or a part of the patient. An element that you won't see inevitably addressed explicitly, but that is there as a very critical undercurrent, is the context provided by the history. Always, examination makes sense in relation to the history that is taken before and during it, and in relation to the use of technology during and after it. Physical examination is not at war with technology. It is used in tandem with technology. It is ridiculous to speak of examination as though it supplants technology. It does not. At the same time, a trap to avoid is to think that good technology makes physical examination unnecessary or obsolete. There are clearly domains in which we want to use each, and we make better use of each if we are skilled in the use of the other as well and in understanding the boundaries and interfaces. Another consistent theme that you will see is the need for positioning of the patient and for having maneuvers that can help the patient to provide you the information that you need. The context of this is courtesy. Again and again, you will see eye contact, addressing the patient by name, and recognizing that we are not slinging around a sack of potatoes, but dealing with a precious human being who has feelings that can be hurt, as well as body parts that can be injured if we are rough, careless, or thoughtless. And all of those whose examinations you will watch on this tutorial are sentient of that fact. So sit back, relax, and please learn. Welcome.